Next thing we're working on is physician-hospital relationships. One of the things we heard in this morning's first talk was about the future of bundled payments and how those are going to be handled at the community level. What is the role for physicians? And our first speaker said if that's done and controlled by the hospitals, physicians are only getting a very small piece of that. What we have been talking about is having an integrated leadership model so that when physicians and hospitals come together, even if it's not employed arrangements, but they're coming together to accept bundled payments, for instance, physicians need to really have leadership roles at that table. And we've been having discussions with leading hospital systems and the AHA about really pushing this forward. Now, future vision CEOs of hospitals get this. They understand the importance of integrated physician leadership. We just need to make sure that that theme goes throughout across all health systems and hospitals in this country. The next thing we're working on is payment. As we heard, there's a plethora of new payment options going on. And if you're looking at some of the Medicare results, you're seeing sort of a hit or miss success on those. But what we don't know is what's happening within the physician practice. We see the outcomes, meaning did the practice save money, or the hospital save money, did they meet certain quality benchmarks, and we're seeing mixed success. But what's happening at the practice level? So we've partnered again with RAND, and they're actually in the field on a study at 6 different markets, as diverse as Little Rock, Arkansas, Boston, Massachusetts, Orange County, and they're going out and interviewing the leading payers in those markets, the medical associations in those markets, and then going and selecting practices to go interview. And I'll tell you what, I had a little bit of a concern that maybe we're a little too out ahead in this study. Maybe there's markets that are still predominantly fee-for-service. But as I debriefed with the RAND team, again led by practicing physician researchers, they said that in every market that we've chosen across the country, practices are moving away from fee-for-service and at least dabbling in some of these new payment models. So I'm excited to see how those models are changing physician practice behavior. Is it about health? Is it about your systems, your IT systems? Can you pull all the information on your diabetics? Does it mean you staff differently? What are those transformations you have to move when you're thinking from a fee-for-service environment and value-based purchasing? So we're going to be releasing that study in early 2015, probably March of 2015. So please look for that. And finally, we're working on technology. And the biggest one is around EHR. And we are right down there in Washington, pressing them on things around meaningful use. And the AMA has had some successes around meaningful use, but we're not where we need to be. And we're already out ahead trying to talk about what they need to do for Meaningful Use 3. And I am optimistic that what they're talking about, at least initially, is going to be hopefully the last stage and much more flexibility. The new head of ONC, Karen DeSalvo, is I think, is a physician, and I think is open to a lot of these changes. Obviously, she works in a regulatory environment, but we've had regular meetings with her, and I think we're starting to hear some of the issues. Beyond technology, though, and what we heard from our talk right before lunch is the future of sort of consumer wearables. And there's a huge takeoff in that. There's probably every week we get a new company across our desk who's got a new product targeted at the consumers. Physicians, and we heard this morning, I'm going to repeat the saying, what Dr. Snyder said, physicians need to be ready for this. Consumers are going to be seeking out these products. And the plethora of companies that are working on them, you'd be surprised. It's quite amazing when you track that. But everything we're doing is about patient care. Back where I started, that we need to be focusing on physician professional satisfaction on these issues because it's all about providing high-quality patient care. So a couple weeks ago, someone asked me this question. They said, Michael, if you solve those problems with your colleagues at the AMA, are doctors actually going to be happier? And I said, if we can fix the EHR problems so that EHRs are functional and provide high-quality care, if we can get payment models that support physician needs and for sustainable practices, if we can help physicians have more organized, run efficient practices so that they can be more successful, if we can get all those things, I think we'll take a vacation if we can have those. And hopefully maybe a little parade, I don't know. But it was a good question. Are those problems actually going to change physician satisfaction? So I started doing some reading and some research, and a good book out there, although he takes a little loose liberties with some of the science, is Dan Pink's Drive, about what motivates people. And there was this theorist here who's passed, Frederick Herzberg. He talks about motivator hygiene theory, sometimes two-factor theory. He says there's certain things that happen in your environment that if they're not there, that cause dissatisfaction, but if they're there, they won't necessarily create satisfaction. It's the motivational factors that cause satisfaction. And on the hygiene factors, he talks about, in his work, sort of a good working environment. And for a doctor's office, that would be, you have a good support staff. They're well trained, they know what they're doing, the supplies are where you need them. Those things aren't going to make you satisfied, but if they're not there, they're going to cause big dissatisfaction. And what he argues in his study, that salary is one of those things. So if you're underpaid, you're dissatisfied, but when you get to a certain point, adding more pay is not going to increase your satisfaction. So I started to think about what are the things we're working on. Well, a functional electronic health record is maybe a hygiene factor. That functional electronic health record is not necessarily going to improve your satisfaction, but when one is not working within your practice, boy, that's a major dissatisfier. A payment model that doesn't sustain your practice is probably not going to make you satisfied, but it's surely going to cause dissatisfaction if you don't have that. So maybe we are working on the hygiene factors first. Maybe we need to go from dissatisfaction to a neutral state before we can think about moving to more satisfied physicians. And there's lots of theories. One is the self-determination theory about what really motivates us. Dan Pink takes the liberties in his Drive book to tweak these from autonomy, purpose, and mastery, but pretty similar. It's about competence, that I'm growing my skills, that I feel like I'm getting better at something over time. Relatedness, that I have the connections between people. And autonomy is the last one. That becomes really a little scary in healthcare, autonomy. And what the research shows, autonomy isn't about the individual who's out there in the wild, wild west who's not following rules. Autonomy is about having the ability to make decisions, having the authority to make decisions. So when I talk about autonomy for physicians, I'm about having physicians having the ability and the authority to make the decisions for what's right for their patients. That's what autonomy is about for physicians. It's not about following benchmarks. It's about doing what's right for your patients and having the ability to do that for your patients. So, these are the things maybe we need to think about a little bit further. And if you read our RAND report, you'll see the same theme, that if you take out electronic health records, which are so unique to healthcare, you look at the other things like fair treatment, responsive leadership, attention to work quantity, the pace of work. Those are issues you might find in any other white-collar profession. That's not how we sort of influence physicians. How do we influence physicians? Regulations, payment rules, financial incentives. It's a threat of malpractice, legal action. It's public reporting. These are the things that we try to do. And the research shows that these sort of extrinsic factors, these carrot and sticks, have limited ability to actually influence behavior for complex tasks. In caring for patients, diagnosing disease is a complex task. But over the course of our history, what we do is we look for the bigger carrot, the bigger, sweeter carrot, or the larger stick, and somehow figure that's going to work. But we know that it has not. So maybe it's time we step back and think a little bit differently about how these mechanisms work, how we think about new payment models. How do they incentivize? Do they really change behavior, and really better understand them as we go forward to improve our healthcare system? So I'm going to conclude by saying something that really came to light in the last presentation, which is healthcare is changing at an ever-increasing fast rate. Change is happening with healthcare, and fast, and faster. And physicians need to be ready for that, or they're going to be taken by surprise. And there's going to be a big debate going on, and a continued debate about the future of healthcare. And what I say when we debate the future of healthcare is, when you have a tough decision, you can usually never go wrong when you focus on patients, or you put patients first. And I would argue few, if any, other actors within the healthcare system care more about patients than physicians. It's not big business, it's not payers, it's not the pharmaceutical industry, it's physicians who care about patients. So as we debate the future of healthcare, not only do we need physicians who are at the table for that debate, we need physicians leading those debates about the future of healthcare. So my ask for you is that you stay informed, that you stay involved, that you continue to participate in the Palm Beach County Medical Society or your state and specialty societies. And if you're a member of the AMA, I thank you. And if you're not, I ask you to consider joining. so that together we can build a healthcare system that is great for America's patients and great for the physicians who care for them. Thank you.